I'd like to call to the podium Dr. Stefan Mustata. Dr. Mustata is a physician and nephrologist in Calgary, a clinical associate professor of medicine, and a member of the Division of Nephrology at the University of Calgary. His research focuses on the effects of exercise in patients with kidney disease, and his abstract was selected as a brief oral presentation. So, Dr. Mustata. Yes, the green.
I know it's just before lunch, so I'll try to be brief. Thank you very much for inviting me. What a fantastic presentation and inspirational about the Kidney Wellness Hub. I'm going to try to talk a little bit about something very similar we're doing in Calgary. We're starting a Transplant Wellness Program, and initially we're going to focus on the kidney transplant patients, liver transplant patients, and then we're going to incorporate lung transplant patients, because we think wellness is something which probably addresses and benefits everybody. The University of Calgary, located in the heart of southern Alberta, both acknowledges and pays tribute to the traditional territories of peoples of Treaty 7, which includes the Blackfoot Confederacy, comprised of the Siksika, the Piikani, the Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including Chiniki, Bearspaw, and Goodstoney First Nations. The city of Calgary is also home to the Métis Nation of Alberta Region 3. We all know this. During COVID, one of our kinesiologists, because we stopped doing the intradialytic exercise program, was doing screening for COVID symptoms at the entrance of one of the main dialysis units, and 4 out of 5 patients, so I repeat, 80% of patients needed walking aids. So frailty is something we deal with on a regular basis, and sometimes we overlook it because we say, oh, what's the creatinine, how's the blood pressure? But our patients are frail. And unfortunately, we all get frail as we get older, but in our patients, this happens way faster, way sooner. So I have patients who are 30, 35, 40, and they're frail. So the answer to frailty, at least in my mind, or in our mind, with our group, is wellness. And as you all know, wellness is very complex. And we talk about physical wellness, mental wellness, emotional wellness, social wellness, environmental wellness. So it's very hard to tackle something which has multiple facets. And we thought maybe we should start with physical wellness and build from there. I wouldn't be here, and our program wouldn't be so successful without Jim Gray, who's our fantastic support and donor. Jim turned 90 in this year, and he still does some sort of exercise on a daily basis. When we get together for breakfast or lunch, he usually asks me, did you do any physical activity today? That's how it starts. So his wife, unfortunately, spent the last 3 years of her life on dialysis, and she was getting more and more frail. And one day, she basically said, we're going to stop dialysis. I had enough. She was very frail. So Jim understands very well what this means. So I'm very lucky to have such a supporter and a donor and a friend. Just to give you an idea, we've been doing this in Calgary for more than 10 years. Chronologically, we started with the kidney exercise and education program in 2012, and then we had a pilot chair program introduced in Calgary where we basically said, if somebody spends 4 hours on dialysis and they're stuck to that chair, they better have the best chair in the world. So we ended up, Jim donated a certain amount of money, and we ended up having the top of the line chairs. And before we knew it, Alberta Health Services, Calgary Health Region, acquired all the dialysis chairs for these patients because the feedback was overwhelming from patients and nurses. So again, there's a lot of patients here. Don't forget, you are the most important, and the feedback you provide when you ask for something, everybody is going to listen, okay? Then we basically said, hey, our patients are frail, so they end up in the hospital. So because they end up in the hospital, they spend a few days, sometimes few weeks, sometimes few months, and then they end up in long-term care. So we're going to need to do something to prevent them from getting deconditioned in the hospital. So we ended up doing the Move More initiative on inpatient service. And we have a kinesiologist who sees these patients on a regular basis, sometimes within 48, 72 hours of being admitted to the hospital. And then we did the kidney transplant prehabilitation clinic, which was very successful. We're trying to get patients stronger before their transplant. And of course, because humans are social and they interact, the head of transplantation came to us one day and said, you know what, I want you guys to do wellness for not only the kidneys. I want the livers and the lungs involved. So here we are getting the Transplant Wellness Program. Throughout this journey, we continued with intradialytic exercise. Right now in Calgary, we have more than 200 patients who actually exercise. They use a bike during dialysis on a regular basis. So this is a comprehensive support program for organ recipients to improve their well-being before and after transplant surgery. The wellness had to start somewhere, and of course we thought moving more would be the first step. And then the other thing, we were very fortunate to have a behavior expert in our team who basically said, Stefan, look at the studies done and published in the literature about exercise. The interventions are usually weeks. If you want to change somebody's behavior, you're going to need years, okay? So that's very important. And since we were collaborating, I noticed the other day that my behavior started to change. So it looks like the team has an influence on me too. So what is the Transplant Wellness Program exercise intervention? So everybody is different. So we said, we're not going to just come up with one exercise. We're going to do a multimodal program comprising of different physical exercises and led by a certified professional, a kinesiologist or certified exercise physiologist. Multimodal means it's a combination of aerobic, resistance training, balance, and flexibility, clearly targeted what the patient wants. We had patients who basically said, I want to be able to work in the garden again, so the kinesiologist has to adjust the prescription. And then the approach is personalized, group setting. I cannot tell you how relevant and fantastic for us was to see the effect of exercise and the Zoom group classes during COVID. I thought the exercise program is going to die. Not only that, more people joined, more caregivers, and they love it, to the point that the kinesiologist has to say, hey guys, slow down talking, we need to do some exercise. So the social aspect of exercise cannot be understated. And while we're doing this exercise, we also provide education. And the behavior change expert is an important addition to the team. The focus is building a sense of control, developing behavior change skills, fostering a community of wellness, supporting sustainable change. And at the end of the day, we want to see people, patients, individuals, see themselves as someone who is actually living well with a kidney condition. So we're trying to make the transition between patient to person. This is a brief overview of how we're going to do it. So we're going to get referrals from both pre and post-transplant. So we're hoping to get most of our referrals pre-transplantation. So the consent is going to be obtained by one of the members of our team. And if in the first graph there, you'll see if the patient is before transplantation, they're going to have the intake. And the first 3 months, we call it exercise intervention. It's 2 classes, Zoom classes per week, backed up by interactions with the behavior expert. And after those 3 months, the patients get into the maintenance program, which continues with exercise classes at least once per week, as well as behavioral support. And we basically thought that we're going to need to do it long term. So we think that 5 years would be a very good length of intervention, because we aim to do 2 things with this program. Number one, to provide solid research, which is lacking, I must say, in the kidney literature. And number 2, to be able to convince decision makers to fund this program long term. And the second one, the second diagram refers to somebody who would be referred before transplantation, but within a month or 2 prior to their transplant. So in that case, we thought maybe it's safer to wait for the person to get the transplant, get clearance from the surgeons as to when the person is able to do it, and get the ball rolling after the transplantation. And we're going to do objective tests as well as patient-reported outcomes on a regular basis at baseline, 3 months, 6 months, 1 year, and then yearly for 5 years. Inclusion criteria. I'm not going to spend too much time here. Age, so adults, listed either active or temporary active or nearly or ready for listing for the transplant, kidney or liver, able to provide written informed consent, approval for exercise from a professional, and the person has access to internet connected device because of the Zoom classes. Exclusion criteria: patient has not been cleared for participation by the kinesiologist or the care team, unable to provide informed consent, clinical condition that makes the intervention unsafe, for example, hepatic encephalopathy in patients waiting for a liver transplant, or something similar in our patients, and unsafe environment for virtual participation. Referral process, very easy. The patients can self-refer. We have pamphlets, and I have a few pamphlets here with me for you in case you're interested. So patients can call, as well as any member of the team. When the patient comes to the clinic, the nurse, dietitian, social worker, pharmacist, nephrologist can refer them. And then the patients are contacted by one of our team members and entered in the project. Outcomes, functional measures. We're going to focus on balance, strength, and endurance. Very simple, basic stuff, which allows people to do more, because at the end of the day, we want our patients to be able to do more. And then patients reported outcomes, and we thought we should probably focus on what kind of physical activity they do on a regular basis, the quality of life, nutrition, sleep, mental health. And of course, we're going to look at healthcare utilization, how many days they spend in a hospital, do they get readmitted, because at the end of the day, we want to make sure that this intervention has a financial impact. So my dream is to have, within the next, hopefully 3 years, a very comprehensive wellness program. We started with exercise and wellness behavior change. We're going to add nutrition, mental health, sleep. People are not alone in this journey, so caregivers, and we have a lot of evidence of caregivers burnout, and I think it's important to incorporate or include the caregivers in the wellness program, as well as potential donors. This is our team. So we have a scientific director, we have a senior advisor, the head of division of transplantation, and a kinesiologist, the wellness behavior expert, and we have patients, a couple representing the kidney transplants and a couple representing the liver transplants, and our manager. And in terms of acknowledgements, first of all, Jim Gray and his family, who have been fantastic, and I learned a lot from them, and they are really committed to this. And our patients and their families, the caregivers, Alberta, and also O'Brien Institute for Public Health in Calgary, the Thrive Center staff, and the Kidney Foundation of Canada. And I can't believe that I have only 5 more seconds, so thank you very much.